My goal is to make it as smooth as we can when you get to the office, so that everything's already looked up. There's really not questions. If you have questions about your insurance, we'll be able to help answer them right away.
Well, hey, Dr. Eric, thank you for doing this podcast with me, man. I really appreciate you. We've known each other for a few years, and you are my eye doctor, and as friendship and in business capacity too. So, thank you for doing this with me.
Yeah, thanks for having me on, Joe.
Today is really about you, to highlight you, highlight your business. So, can you tell us a little bit about yourself?
Yeah, so my name is Dr. Eric Jerde. I'm an optometrist in Sunset Hills, Missouri, one of the suburbs of St. Louis, Missouri. And we do a lot of very primary care, but we also do a lot of treatments for our patients whenever they're in urgent and emergent situations as well. So our business name is Jerde Eye Specialists, and so we made it that name just so that we know that people can come to us for more than just glasses and contacts. It's a huge passion of ours to make sure that we're up to date with the best technology that we can, to be able to take care of everything under one roof.
I do have a couple of specific questions when it comes down to like care and where eye health has developed over the past few years. Tell me about why people don't want that puff in their eye anymore, and what options do people have for that in your office?
Yeah, so the puff of air is an okay screening device. It gives you a basic measurement for glaucoma risk, is what you're talking about.
Yeah, okay.
So with that, the puff of air is, like I said, it's a screen device. So instead of screening our patients, it's an easy test for me to go ahead and measure their direct pressure measurement. We call it Goldman applanation. And so that's a direct measurement of the pressure inside the eye. Basically, if I send you to a glaucoma specialist, someone that would do extra treatment, surgical treatment on the eyes, they're going to be doing the Goldman applanation. So we went ahead and decided that we're going to be doing that in our office instead of just screening people. We're going to go ahead and get our accurate measurement every time.
So you're doing the best. So like, okay, listen, if I've got to send you out for an X-ray, right? We all have had no or feel an X-ray. I'm going to go ahead in our office and do the MRI already for you, because that's going to be the best source of information. Is that what I'm understanding you're giving these people?
Yeah. So, I mean, if I do the puff of air and I say that measures your pressure, and then I go, well, now let me measure your pressure.
Right. Yeah. You're doing
I think that's
things.
what you're saying, right?
Yeah, exactly. Oh, that's awesome. Can you tell me somewhat about the vision of your company? Tell me about the vision of your practice.
So one of the early names that we wanted to call it was Innovative Eye Care Specialists, and that's actually my LLC name. But we ended up going with Jerde Eye Specialist just so that you knew who you were seeing when you came in the door. It was also a little shorter to write, but the idea there was I want to make sure that I am being innovative. I want to make sure that I'm bringing the latest technology to the eye exam, and to what my patients' options are, from eyewear to from glasses and contacts. So one thing that's been around for a few years now, and it's in many offices, but it's called Optimap. So that's an alternative to dilation for patients. That's a huge factor for patients to not have to be dilated in all circumstances. It's a very good device that allows us to identify the shape and size of optic nerves, of blood vessels, of freckles that can lead to melanoma. So it's a great device that we can watch over time with every person's eyes. I can put them side by side from last year to this year, and look at that health. So that's something that everybody can appreciate in the office every time they go in for their routine eye exams. And then there's more advanced things that have come around. You've probably heard of blue light filters. Well, now they're putting that in contact lenses. So
Oh, wow,
there are
that's cool.
yeah. So there are daily contact lenses that we're fitting for patients that have blue light filters in them, and it's a pretty big game changer, especially for my patients with dry eyes that are on screens a lot. Screens we know dry out our eyes a lot anyway. We know that the
For
blue
sure.
light is hard on the eyes as far as just light intensity goes. So it just kind of it makes it more comfortable for those patients. It's not something that they necessarily have to have. So I'm not fitting every patient in blue light contacts, but there's definitely a good portion of the population that really appreciates what it can do for them because they've struggled with everything else.
Well, yeah, it's nice. You're the feeling of what I'm getting, Dr. Eric, is that you're passionate about making sure that you can provide the best level of service, and get the most information for your patients as well too. You're not just saying, all right, well, I'm going to make up numbers because I have no, you're the expert on eyes.
I'll help
So
you.
we're like, all right, yeah, thanks. So you're okay. Well, you're a +3 on the left side. You're a +2 on the right side. Yeah, we've got a glass cutter in the back. We'll just shave you some lenses. Adios. I'll see you next year. You're going well above and beyond so that your patient gets their eyesight is a huge piece of their life.
Yeah, here's a little secret that I'll tell my patients sometimes. I was going to be a math teacher at first when I was going through school. And the reason for that is I do enjoy teaching people. And so when my patients are here, it's not just about getting them glasses and contacts, like you said, and see you later. It's the question of why is this change happening? What's happening to me? And how can I help you understand what's going on? Because in the future, that's going to help me understand what's changing because you're going to be able to give me a lot more input because you're leaving knowledgeable that day.
What do you think are some of the biggest things that are disrupting St. Louis, and what are things that are you doing to make things in your circle of influence more magical, but bigger, better, and more exciting?
Yeah, I think I can take that question to a little bit bigger of a level with healthcare in general. I don't know if you've had to go to an urgent care or an emergency room anytime in the past few years, but ever since the pandemic in 2020 started, it's definitely changed a lot of parts of our lives, not just healthcare, but access to those areas is tough. So
Yeah, it sure is.
when patients have an eye problem, eye pain is a very severe pain. So when someone gets something in their eye or when someone gets an abrasion, that is a huge pain. So they go to the urgent care, they go to the emergency room, and urgent care and emergency rooms are great. They're going to save our lives. The problem is the wait time with that level of pain is pretty hard on those patients. And sometimes we're talking multiple hours to where it's
It's
long
unbearable.
suffering with something in the eye. And granted, that's not going to be life threatening. So we understand why these emergency rooms are pushing eye pain off. But when it comes to our office, when those patients call us, they get a work in pretty strong into my office. That is one thing that we definitely do not tolerate. Whenever someone's in pain, if they cannot tolerate it, we tell them, come on in, we'll work you in, just be patient with us, but we're going to get you taken care of. And so that's one big thing that I can say that we're really working with the community to make sure we provide really good care. And I'll have urgent care doctors at the local offices that will send me eye patients if it's a little outside of their comfort level. They'll say, hey, can you take a look at this one and let me know what you think?
Yeah, that's great. I know, like for me, even if when I get a speck of sawdust in my eye, all right, done. I'm out. I can't
Yeah.
imagine having something more intense, any abrasions going on. Oh man, it's got to be horrible. It's got
These people
absolutely
can't
horrible.
sleep, Joe. They can't sleep. I mean, they are very uncomfortable. So um, that's one thing that I think people are realizing that's what we can provide for them, and so people are getting to us a little faster than they used to in those situations. But I try to stress to all my patients, because I'm seeing a lot of people in their routine eye exams, but
Right.
I try to let them know, hey, if something happens with your eye, call us. Let me help you get through those
I'm
things.
not just
So
here
it
for
can be as simple
your
as
checkups. I can help
yeah,
you. I can do
yeah.
this.
Well, it's like if you go to your doctor, if you have a cold or a flu, right? You don't just go for your physical. You don't just go to the eye doctor for
Yeah.
your glasses and contacts. You go if you have an eye problem. It can be pink eye. It can be
Absolutely.
something stuck in the eye. It can be styes, those sorts of things. We're going to take care of you.
That's great thing you got going on in the office.
So we do have a new dry eye device. It's called Tear Science.
Ooh.
And what it does is it actually expresses part of the tear film out of the eyelids. So let me take that a couple steps for
Okay,
you
yeah,
here.
yeah, yeah. Like tier film.
Yeah,
Like,
yeah.
can we? Is Pfizer manufacturing this tier? Like, who's making this tier
No,
film?
no,
No,
Pfizer's not
all
on this
right.
one.
What's tier film?
So with this, with your tear film, just everybody's tear film, there's actually three layers. There's the mucus layer, which is the part that sits on the eyeball. There's the water layer, which we all think about when the tears are wet. And then there's the oil layer, which sits on the outside. The mucus layer, that's what crusts up overnight if you get sleep in your eye or crusties in the eye.
Got it.
That's the mucus layer. And then during the day, the surface of that tear film, your oil layer, that's what evaporates. So that's what causes stress during the day, especially our computer patients or people that are hours at the computer. Their eyes, they're not blinking as much. Their tear film is running out. So their oil layer is deficient, which means their tears are evaporating throughout the day a lot quicker than normal. So one way that we can help out producing more of those oils is to help clear out those glands. Not exactly the same concept here, but think about clearing out a zit. Okay. So
Okay.
these glands are made of oil. And so when those oil glands start to get blocked up and they produce less and less oil, they need to be expressed. If they're not expressed over time, that blockage gets worse and worse and worse. It gets gunkier and gunkier. Think about not taking care of
Oh
your car,
man.
you know? So what we do is we heat up the eyelids for about 15 minutes with this device, and then I actually express those glands from the bottom lid and top lid of each eye. The
You're gonna
whole
have to YouTube
procedure.
that. You know that that's the next step, right?
Yeah, so it's pretty phenomenal what can come out of those
You
eyelids
have
there.
Dr. Like seriously, you need
Yeah,
for like Dr. Pimple Popper fans out there, like sign some waivers for that patient. Let's get
there
that
you go.
sucker on YouTube.
Yeah. So
Seriously.
once you clear it out though, now that gland functions properly. You know, just like when you're adjusting people, you're getting
Yeah.
the body to function properly. So I'm doing that with these glands, and these glands have a lifespan. So if they start to atrophy, I can't get that atrophy
No,
back.
you ain't gonna get that back.
Yep. And so this device is a great dry eye device for patients that we brought in this last
Oh,
year
that's
here
nice.
at the office. And so we're able to keep their glands producing well.
Good. What's the so you said like okay, so there's a chance for atrophy. What's the chance that that gland is going to get stopped up again? What's the recurrence of this?
Yeah. So what we do once we get that cleared out, we do what's called hot compresses. So by
Hmm.
keeping that gland heated, you're going to keep that oil nice and soft and
Okay,
actually more
nice.
of an olive oil consistency
Cool.
versus what I describe as a Crisco consistency. That's what I'm getting out of these
Mm.
glands. So through routine maintenance, you'll be able to keep them pretty clear. Now, at first, we might have to do a little bit of quick maintenance again. Quick maintenance might be 6 months, could be 18 months. But that's person to person. Usually, young people respond really well to this treatment.
That's nice. So you come in, you get checked. Hey, chance it could be coming back. We'll get you in another 6 just to double check it. You know, we're gonna check it anyway. So yeah, that's awesome.
Yeah.
Um, how important is health to your business? What are some things that you're doing to keep yourself and your team optimized really well and burnout free?
Boy, burnout's a big word there.
Yeah, it is.
Um, So as far as burnout goes, we make sure that we have an admin day during the week. There for a while, I was doing 6 days a week myself, and that's hard to carry on. You do that as a small business, and especially as a growing business with limited access to help because you know
Yeah.
you're trying to grow your business. So there for a while, I was doing a solid 6 days a week, taking it down to 5 days. That helps me to be able to do more of my administrative things. That's what today is, for example. So you can't see it to the sides, but I've got bills on the sides of me here. But so that helps me kind of keep things organized for the office, but it actually helps the staff out quite a bit too. one thing that happens when patients call is we take down their insurance information, and we make sure that we look it up before they get there. So if there are any issues, these sorts of days really help the staff to keep organized. That's our goal. Does it happen every time? No, that's impossible. Things can happen. Curveballs happen. People's insurance can change within a week. I mean, mine just changed 2 weeks ago. So
Yeah, for sure.
those sorts of things can happen there, but that's really what helps keep us stay focused, is by having a day. And I know Thursday's a day of the week, and sometimes people have a Thursday off. So we counter that by we also work on Saturdays. We do from 8 to noon on Saturdays. So if patients do need a specific day of the week, hopefully we're giving them an extra one there. And I'll also flex it a little bit too, to where I'll end up seeing patients on Thursday one day a month instead of seeing them on Saturday that week. So those are the things that we're trying to do to keep our schedule a little flexible for all of our patients there.
That's nice. It's nice to have that flexibility that they know that they can get in should they need to. And also, man, you're so right. It's critical to have that day of the week to do. I Eric, my desk is this, I'm assuming this, it's pretty messy, but it's bills, it's St. Louis County revenue taxes. You should be getting yours pretty soon too.
Oh no, they don't collect that anymore.
Well, you got to do your verification. You got to say,
Yeah.
because they want their money. I always, but yeah,
Yeah.
it's like you need that time set aside, so whenever you can compartmentalize yourself, like, hey, I'm just going to focus on you as a patient. You're here. I'm going to take care of you. But always I have to have time to make sure that your experience is still going to be genuine on those times too. So we need those times for admin work as well too. Just that it's
Yeah.
it's the name of the game. It's really the name of
Yeah.
the game.
I will say the other thing that really helps just the general of the office is that the staff are they're really good friends of ours, at this point. So it really is a nice, relaxing environment for all of us to work in. I always say nobody loves going to work to just work. So we go there to help take care of people. We go there to help take care of each other, so that we can take care of our families as well. So it's a very rewarding environment for all of us there, and we look out for one another. Someone's
Of
going to be sick
course.
every once in a while. Someone's going to have life events that happen. So you look out for one another. And that's a really good balance we have at the office right now.
That's awesome. Awesome. Well, Eric, like I don't have any, man, this is great. I really appreciate your time today. Um, I'm due for my checkup, so I got to get in in the next month. So you'll be
Those
seeing.
reminders don't come from me. That's my staff there.
Well, listen, we're both spoiled. We both have good teams that we can rely on. So thank your team,
Yep.
from me. And yes, I'll be in. Don't worry.
Absolutely. Well, I
Cool.
look forward to it. And I really appreciate you inviting me on today.
Yeah, it's been great. It's been really cool.